Welcome to the show once again. This is Medical Mind, and we are here with Doctor to look at sperm and egg donation in both men and women. As I told you earlier on, teacher, doctor. Teacher us. In our class, there is no repeating, there is no examination, there is no correction, but there is learning, understanding, and asking and inquiring. Welcome to Medical Minds. Doctor, say hello to the viewers.
Yes, good evening, viewers, and you're welcome. Today is quite interesting.
Very interesting, Doctor. Yeah. Thank you so much. Last week we had a lot of questions that we didn't answer. Yes. We promised to give them back today, but we shall first start with the topic of discussion, and then as we wait for callers to come in, we shall keep on answering those questions one by one. Perfect. Straight to our point and topic of discussion, Doctor, egg donation, sperm donation. Yes. Medically, what does that mean?
Yeah, so in simple terms, sperms are the cells, they are the main reproductive cells from the man, and they're the ones which carry the genetic material of the man to participate in the formation of a baby. And the egg, on the other side, for the females. Now, for some, in a case of a couple, there are some situations where maybe there's a problem with the sperm or there's a problem with the egg, and you can't get it from the couple, you have to get it from another person. So it can be for the sperm or it can be for the egg. So that's when we talk about sperm or egg donation. So you are getting the sperm or the egg from another person to help the couple get a baby.
A baby.
Yes.
Doctor, do we do this medically when both couples cannot produce, if the woman cannot produce the egg and the man cannot, or one of them is eligible to having at least, like for example, a woman can be having an egg and the man doesn't have, or alternatively, what if they all cannot? Can we as well help them in that way?
Oh yeah, so this is an issue which has both medical and social psychosocial dimension. But from the medical perspective, yes, it is possible if, for example, one of the partners, either the man has no sperms or has a problem with the sperms, or if the woman has a problem with her eggs, yes, that is possible. And if both have issues, then you can have donation of both sperm and the egg.
From different couples.
Yes, so this is from the medical and technical point of view. Now, I told you psychosocial aspect of it. Now, this process, as I told you, the intention of reproduction is to pass your genes to the baby, you know. Now, in a case where one of the partners is not able to participate in this, you forfeit her or his contribution. Now, how acceptable this is for the partners is entirely their decision, and it is dependent on culture as well. Now, you take the case where both of them have to forfeit. Now, this again depends on their perception and the perception of, the societal regulations. But from the medical perspective, yes, it's possible.
Okay.
Yes.
Thank you, Doctor. How is the process carried out?
Yeah, so it depends on what we are donating. It depends on what we are getting. For example, for the case of the egg donation, it has to be part of an IVF process. Yes, because by biological design, the woman's eggs are hidden inside her body. And so you have to get those eggs out.
Out?
Yes.
So the fertilization cannot take place in the body?
It can't take place inside. So in this case, if she's not able to have her eggs, then you need to get the donor's egg out, fertilize, and put in the woman's womb.
Oh, you first fertilize it outside, then you put it there.
Yes.
And it grows normally?
It grows normally and everything else is okay. Okay. That is if the problem is with the egg. But if the problem is with the sperm, then for the sperm there are a lot of options. You could do insemination. Yes, what we will probably talk a bit about, what people call artificial insemination.
That we do in cows, animals?
It's similar. Actually,
okay.
that thing, the application in humans was derived from the knowledge
from the animals.
Okay. Yes. Okay. So you can have the donor's sperms, prepare them, and then put in the woman's womb what we call the artificial insemination. Or you could go a step further. Instead of just putting the sperms in her womb or the cervix, just like that in artificial insemination, you could fertilize, you could go through an IVF process. Then instead you get the woman's eggs out, fertilize them outside, and put them in the womb. Yes, because there are times this second option is sometimes indicated in cases where the woman has her eggs, but she also has issues with the tubes, and that's the commonest. The woman has the eggs, but she has problem with the tubes, and then the man has problems with the sperms. So his sperms cannot be used. Sometimes the problem is not with the sperms actually. The problem is something else. For example, some genetic diseases which cannot be corrected using the current technologies. So you only have the option of avoiding it by using a donor sperm. So in such a case, you have to fertilize outside because you cannot do insemination in a blocked tube. Okay. Yep.
Thank you. Before we look at the cost, Doctor, let's look at the artificial insemination.
Yes.
Do you use a syringe or you can do surgery? Which method do you use?
So the approaches to the artificial insemination, you know, like any principle of medicine, we try not to complicate things. You go for the simplest but most effective method. Yeah, so we do not do any operation.
Oh, okay.
Yes. Let's see steps in artificial insemination, intrauterine insemination. This is comparison. There was some illustration. I think I can have a look at it. Okay, it will come up. But it's in terms of steps of artificial insemination. Yes, it's like it is. The basic thing is you're getting the sperms from the donor, preparing the sperms, and then putting the sperms into the woman's womb in the process of artificial insemination. Yes, but before the sperms are put inside there, the woman also has to undergo some medication to improve her eggs. The eggs, at least 2 or more eggs must be released. That increases the chance of conception in this artificial insemination.
Okay.
Yes, that is the baseline for the artificial insemination. Yes. Now, in the donor program, before these sperms are used, they are supposed to be quarantined. This is very, very key. Now, what we mean by quarantine is when the sperms are provided, the sperms are kept either in the clinic, IVF clinic, or they are kept in the sperm bank where those exist.
Okay.
Yes, and they are kept there for about 6 months before they are used.
Okay, for about 6 months?
Yes, before they are used. And the reason is that when you are doing artificial insemination or when you are doing sperm donor program, you don't want any infections to go through the sperm into the woman or to go into the child as well.
So that's why you keep it away for the 6 months?
You keep for 6 months. So in this period, you check you check the man, the donor, the person who gave the sperms for any diseases which hadn't sewn up. For example, HIV and all those things. So after they have provided sperm, you follow them up after like 3, 4, 5, and 6 months. And if they are negative, then you can use their sperms.
If they are positive?
If they are positive, you discard.
What if they have STDs? Can it be treated?
They can be treated, but then you will not use their sperms.
Oh, you will not use their sperms?
Yes.
Okay.
Yeah.
Thank you so much, Doctor. Let's look at the costs.
Yes, the cost of artificial insemination. Now, artificial insemination is not very costly compared to other methods of fertility treatment, actually. In terms of costs, the average, it ranges between 2.5 to like 5 million.
Okay.
There's some variation a little bit because of one, sometimes the clinics themselves, the fertility clinics, they do vary in their costs, but also their variation in according to the medications you will use for the woman, because she has to undergo some medication, and the choice of the medicine depends on her hormone profile, her age, and other things.
Doctor, before you finish that point, you mean before the whole process takes place, a woman has to go some treatment, tablets?
Yes. So,
so what are those tablets for? To prepare the body, boost the hormones?
Yeah, so I think I need to clarify a bit on the process. I saw an illustration coming up
we can
on
look at the process
of artificial insemination.
Yes.
Yes, exactly. This is it. This is an illustration. So now, naturally, the woman's body is designed to release 1 egg per month.
Only one?
1 egg. In rare occasions too, that's how some people get twins.
Twins, okay.
Yes.
Okay.
So, but to increase the chance of artificial insemination, you want more than 1 egg to be released. So we usually target 2 or 3 eggs to be released, so that at least one or two of them can be fertilized. Yeah. So she undergoes what we call ovarian stimulation. Most times, this is a mixture. In our unit, we use both tablets and injections.
Okay.
But in some cases, you end up using injections only. So the woman will undergo these injections or tablets for about 14 days. And in that time, we monitor how her eggs are growing. Okay? So we also want to ensure that she doesn't grow so many eggs. Okay? Because you'll get too many babies. You get 6 at the same time. Yeah. So if there are too many, we stop the process.
Okay.
Yes. Then, when the eggs are ready, we give some medication for her to release the egg, so that the eggs can be picked up by her tubes, and then at that time we do insemination. Now we prepare the sperm. This is what we do. We prepare the sperm so that they are now more active, because we put them inside the womb, but not on the egg. The egg is around here. Okay. So the sperm has to be able to swim. To
swim and go by itself.
Exactly.
Okay.
Now, once we've done that, we also give the lady some medication to support the early stages of the development of the pregnancy, what we call the luteus phase support. So it's a whole process. Although the name is insemination, not the whole insemination is not the whole entire time.
It is process by
it's
process.
It's a process by
Generally,
process.
There are like 5 different
Yes, you have to go through stages.
Wow, that is very interesting. So after all these processes and the time, is it guaranteed that the baby will develop? Will it be successful?
It's not a guarantee that in this one cycle of the process you will get the pregnancy. It's the success is about 3 out of 10.
Really?
Yes, 2 to 3 out of 10.
What could be causing that failure after all this 6-month preparation?
It's not really 6 months. This whole thing is just like 1 month.
Oh, 1 month.
Yes, and it's
because earlier on you said you can first store the sperm. Is it the eggs for like
the sperms,
like for 6 months?
Yes, you store.
Okay.
Now for that part of the storage of the sperm is the work of the clinic. The clinic is doing this because most of these clinics which do this process, and even those which have the sperm banks like ours, we keep the sperms because we know somebody will need it. We keep the profile of the person who is giving the sperms and all that earlier, without even knowing who is going to use. Yeah, so when somebody shows up, they need to use it, and we confirm that indeed it will be very important for them to use it, and then we get it.
Okay.
Yes, so that's it.
Thank you so much. There's someone really needing you here.
Yes.
He's saying, Doctor, how much does IVF cost? I think he's planning to take. It's called Charles. Child, yes. He wants to know the exact cost that he prepares his pocket. Yes.
Yeah. So IVF. Well, the cost varies, but in our unit, the variation is between 15 to about 19 million.
Is it payable in installments?
Well, usually depends on the exact protocol we are using. Most of them you can pay in parts.
Okay.
Yes.
Okay.
There are a few which involve some genetic diagnosis which you have to pay most of the money ahead of time.
Okay. Thank you so much, Doctor. So when is this sperm donation egg needed? When does the medics decide and say, you know what, I think
you need a sperm donation?
Yes, for now you need sperm donation.
Yeah, so for the sperm donation, the commonest thing, I will talk about the indication in our environment. I have to stretch that, the indication in our environment. Now, in our environment, the commonest indication for use of sperm donor or donated sperms is a severe problem with the sperms. Either the sperms are so few and so abnormal that they can't be used, even with advanced assisted fertilization through IVF, you find that you cannot use them. But commonest absence of the sperms, and even if you try to retrieve from the testicles, you fail to get them, and then the only option is to get the donor sperms, the donor sperms. Okay. But also the second indication is genetic diseases. That has to be considered because we talk about too many genetic diseases here. There's one disease called cystic fibrosis. Now, this disease, the commonest presentation is repeated chest infections. So you find somebody is having repeated chest infections, and when you do genetic testing in them, they have cystic fibrosis. And in this case, you cannot use their sperms because the same condition will be passed to the baby. Okay. Yes. But also the same situation happens in some cases in people who are sicklers. Now, if the man, if the man is a sickler, that is, he has both genes for the sickle cell. That means all the sperms he produces will be carrying the sickle cell gene. And if he meets another person who is either a carrier or who is a sickler, most likely they will produce, chance of getting babies who are sicklers are high. But there is a possibility if they meet somebody who is not a sickler, who is not a carrier, all the babies will be just carriers. Now, this is information which they have to look at and see and decide. For example, in the cases where they could get carriers, sickle cell carriers as babies, do they want that or they don't want that? Because those are things you cannot manipulate with genetic engineering at the moment. Yep.
That is very, very interesting, Doctor. Before I go further, there's someone saying, hello, Doctor. I'm asking, saying good evening. Thanks, Dr. Underbart, for the program. I would love to know what exactly IVF means. And secondly, I have a sister of mine who happened to deliver one kid, but it's now 10 years. She has failed to conceive. What could be the problem? Before we proceed, because I think they want some clarification about what you're trying to explain. Yeah, they want
what is IVF.
Yes.
Yeah, I think I have some illustration, if I could have that. IVF illustration, let me see.
The first illustration we had?
I think it's IVF versus insemination.
Okay.
IVF steps. Yeah, yes. This, I think this is it.
Okay.
Yeah, so we are in simple terms, IVF. Now, this is what happens in IVF. In simple terms, what happens is that instead of the man and the woman meeting, so that during this process, he deposits the sperms in the woman's genital system, and then the sperm finds the eggs inside the tube, fertilizes them, and then the baby is formed, and that grows in the womb. Everything happens inside. Fertilization is inside, okay? But in IVF, we have to remove out the egg and fertilize the egg. Yes, we have to remove the eggs out, fertilize outside, and then we put in the woman's womb. So the eggs grow in the ovary as expected. We remove them, and then we fertilize in a process in the lab. And then after fertilizing, you will get them growing, and you will pick the numbers you want, and then you put back in the womb. So it's called IVF, that is in vitro fertilization. Vitro means glass. In the lab, we use a lot of glass. Yeah, a lot of our equipment.
So I is in.
Yes.
V is
vitro.
And then F
fertilization.
Excellent.
Yes.
I think you've had the explanation very well. This is, although you didn't indicate the name, I means inside, V vitro, that glass. Yes, doctor has given us the excellent explanation. I told you this is a class. You are the listeners, you are the children, you are the learners. Get to understand everything that you want to know. It's all about facts. Thank you, doctor. What are the terms and conditions? Someone is asking. Oh yes, doctor. Doctor answered that. There was someone who was asking the cost. Yes,
the cost of the IVF.
The cost of storing eggs. Yes, the cost of storing those eggs.
The cost of storing eggs. I think also I could mention that one of the sperm as well. Now for
like Charlotte wants to store her eggs. How much can she? Yes, how much can she prepare?
So egg storage is one of the topics we will take one day and try to talk about. But briefly, it's a good practice because as we know, that women have a biological clock. What it means is there's a time period when the fertility sets in, and there's a time period biologically when the fertility stops. And that is a manifestation of the time of beginning to release eggs and the time of stopping to release eggs. That's the menopause. Menarche to menopause. That time is fixed and fixed by God and biology.
When you pray, miracles won't happen.
Yes, miracles do happen, but God is the one who has designed this. So, yes.
And can be the one to give you the miracle as well.
Oh, yes. So now we work with this biological clock in mind, and the start is usually around 10, 12 years. And of course, you don't start getting babies around that time. So you may start thinking about babies when you're around 20, 25. And then the stop is around 45. Now, because of career, people are beginning to get married late. One's career, another time is because they are still looking for their suitable partner. So you find people start giving birth, trying to think about giving birth in their 40s and
late 30s.
Yes, late 30s, which means they don't have enough time now because the biological clock is coining them down. Now, to avoid this sort of situation, we are encouraging people to store their eggs. By the time you reach 30 to 35 years, it's better to think about keeping some few eggs. Just in case you do not reach your reproductive potential, you can use them. They can be stored very well. And
for as long as you still want them.
As long as you want them. Yeah.
I think I should visit the lab and see it physically.
Oh, yeah, you can visit, and it's a very impressive place. Yes, the science in that area has really advanced, and it is what keeps us smiling. It's a really good one.
So now Charlotte wants to store her eggs.
She wants to store her eggs. So the storage of the egg requires her to undergo some medication so that we activate her eggs. We remove those eggs. Okay. Now that process, because we have to give medicine and remove the eggs, that costs about maybe 6 or 7 M. The whole process there, and then we do the storage. The storage may cost maybe 1 million or so for that time, and that is enough.
How long? For how long does the 1 million?
So this about 7-8 million, which she will pay, can cover the first year. Okay. Then the following years, she doesn't have to pay those monies. She pays some, I think, the yearly fee of about 1 M. Yeah. So we are trying to see how to reduce that, because if we have more people storing the eggs, the cost of storage goes down, because these are really maintenance of the storage devices. Yes, they need some things, they need engineering services and all those things.
True. Yeah. Thank you so much. I think, Charlotte, you've got that. Please start planning and see a way of storing the egg. And for us also, other mothers who would feel like you're giving birth very late, this could as well help you in one way or the other, because you might want to give birth and then the eggs are nowhere, yet you were able, but you didn't know that you're wasting all your time. So we're going to have a very short break, and when we return, we shall look at other steps that requires us to acquire I sperm and egg donation. And this is Beth and Tebe. We're together with Doctor in the studio, learning and discussing about sperm and egg donation. Before we went for the break, we were looking at the steps and different stages. Now we are here asking Doctor another question: that what are the terms and conditions attached to this process?
Yes. The terms and conditions. First and foremost, people have to equate this process to other forms of donation. For example, blood donation.
Blood donation is free of charge.
Free of charge, yes. Blood donation is free of charge.
Yes.
Yes. And even other organ donations, kidney donation, and all those are free of charge. These are biological materials which we don't create ourselves, and they have value beyond what we can estimate. So we don't pay for them.
Oh, just to be free.
We don't buy them. They are free. But what we give the people who donate them are what we call stipends. They cover inconvenience. So the major driving force there is really goodwill.
Oh, it's just an act of goodwill.
Yes, it's an act of goodwill, and but we do give them support in terms of it, because somebody will spend time to come and do this, and so you have to compensate them for that.
For their time.
Yes, for their time. So we don't. Yeah, that's the thing. Both for the sperm and also for the egg. And human beings are different. People are giving, people provide.
Yeah, sure.
Yeah,
some people
so
are
they
kind
do.
And
Ugandans are the
true,
best.
True.
They do.
Thank you so much.
Yeah.
Doctor, who can become a sperm donor or egg? Can anyone come and get qualified, or you can say, no, this category of group of people are not qualified to donate? Yeah,
so as I said, the first step is to be willing to donate. For example, for the sperm, the person should be willing to donate. And then we have eligibility criteria for fitness to donate. One of them is age. For somebody to be a donor, they should not be beyond 40 years of age.
Really?
Yes.
But men can give birth even as old as 60?
Yes, they can give birth on their own, even 70, it is fine.
So those sperms can expire, they grow old? Or?
So what we now know is that beyond 40, there are some problems which become more prevalent, especially at the genetic level. The sperms are okay, but the level of breakdown of the genetic material, what we call DNA defragmentation, in the sperms increases. Okay. So we do not want, where you have an option, you don't want problems to linger around.
Don't want trials, yes, okay.
Yeah, so people beyond 40 years, we do not. And people below 18 years, they don't.
They don't.
Yes, because they haven't yet acquired the mental reasoning to provide.
Wow. Okay.
So for the sperms, that's the case. Then for the egg, the numbers are, the ages are even much lower. Oh. Yes, for the egg, somebody should not be beyond 30 years. Yes, and of course, should not be younger than 20 years.
Younger than 20 years.
Yes.
Thank you. Do we have any side effects of
donation of like the sperm?
No,
we don't have any side effects really.
You remain normal?
You remain normal.
Wow, that's good.
Yes,
okay.
And the same thing with the egg actually. There are no obvious, now we have a lot of information which proves that even if the woman donates her eggs, she will not lose her reserve.
Okay.
Yes,
that's
because
good.
The way the body is designed for the woman is such that whether she gets pregnant or not, every month she's removing eggs. Whether she uses them or not, they will be thrown away. Now those are the eggs we use.
Okay.
Yes.
Thank you.
So there's really not something big to worry about.
True. Thank you so much. If you're there and always are willing to donate, please feel free. It's free of charge, and it's an act of kindness. You could be saving a life, you could be giving a life somewhere, and it's because, just like Doctor said, we dispose and throw away these eggs each and every month. So if you feel like you can always give a hand, you can save a life, you can give a life, please feel free to do so. Because in the end, the blessings come back to you. Doctor, are HIV patient eligible to sperm donation or egg?
Yeah, that's a very good question. At the moment, it's an exclusion.
Okay.
Yeah, we do not, we don't use egg or sperm donors who are HIV positive, even if they are on medication.
Okay.
Not that they will obviously transmit the infection. It's because there are still some scientific aspects of HIV which we still don't know. Because HIV, if you take out the germ which causes the disease, it's a virus, and that virus has a genetic material. So its genetic material interacts with the genetic material of the human being, and that interaction, the fate of that interaction is not yet fully understood, even though we have very effective medications now. So it is safer because some of these genetic material, some of these viral particles hide in areas which we still don't understand yet. Yes. So that's why when somebody is on HIV treatment, it's a lifelong treatment, even if you turn to be negative. Yes.
You need to continue treating.
Yes.
Thank you so much, Doctor. Our lines are on now. You can prepare your questions. You can send them on WhatsApp, on the numbers on the screen. You can be able to call and speak direct to Doctor as we answer these coming in questions. Doctor, good evening. Thanks to Dr. Albert for the program. I feel some movement in my ovary. What could it be? This is someone sending you from, I think you didn't put the address, but she's like, she feels a lot of, I don't know whether she's expecting or not, but she says there is a lot of movement in her ovary.
So I think she's talking about sensation of feeling of movement in the lower part of the abdomen, because people often talk about that. Well, there are many things which are down in the lower part of the abdomen. There could be ovaries, there could be the tube, it could be the womb, it could be intestines, the lower part of the gut. So any of this is possible. But if it is specifically related to the ovary, maybe there could be cysts. But in this evaluation, if it's a concern, it might be something else. Yeah, most likely something related to intestines also, maybe infections.
Thank you so much.
Yeah.
And hello, Doctor, I keep getting pregnancy signs after my period, till the next period. What could be the cause? Please, will I be able to conceive? I'm looking for a baby.
Yeah, so getting pregnancy symptoms during that period is usually because of two things. One, the hormones of the body, because the body's hormone after ovulation is close to the state of pregnancy, because it is supposed to support the pregnancy. So you can get symptoms of those hormones, the progesterone, estrogen levels. They are in the pregnancy levels, so you can get those symptoms. Yes, but these symptoms are exaggerated by expectation. The psychological expectation amplifies these symptoms. So, but the baseline is, if she's trying to conceive, she needs it evaluated. You know, there could be some other underlying cause, and you don't want her to go into the range where other problems come in. Yeah.
Thank you. Good evening, Bethan TV. Wanted to know if you people also have DNA test and how much it is, DNA.
Oh yeah. So we do a lot of genetic testing in our process of IVF. Whatever specifics is asking, I do not know, but there are different types of genetic testing we are doing. Maybe she's referring to the genetic testing which people use for sex selection or for genetic diseases like sickle cell. Yes, we do those as well. So, but as far as fertility treatment is concerned, we are able to do the whole range of the genetic.
Thank you so much. Doctor, there's someone on the line. Good evening, Bethan TV. Sorry, we've lost them. Sorry, I think it's network. You can keep on sending your messages. If you cannot go through the line, we shall read them here live. This one is saying, good evening, Doctor. Kindly explain briefly something about surrogate mothers.
Yeah, so thank you for that question.
She didn't indicate her name, but...
well, we will explain as that. Yes, so surrogacy actually is a form of assisted reproductive treatment, or is a form of IVF treatment where somebody other than the woman herself carries the pregnancy.
For somebody else?
Yes. So the couple comes, they have a problem with the carrying a pregnancy.
You have a caller, Doctor, shortly.
Yes,
Bethan TV, good evening. Hello. Good evening, caller. Thank you. I think we've lost him.
Yes, so surrogacy is that arrangement. So the person who carries the pregnancy is called a surrogate mother. Yeah, so it's not the biological mother.
What happens here, Doctor, briefly? Does the fertilization take place somewhere else or in this mother?
No. So surrogate, the commonly practiced one, the commonly practiced form of surrogacy is part of an IVF treatment where the fertilization occurs outside.
Okay.
Yeah. But we also need to remember that there is other forms of surrogacy, which we call traditional surrogacy. Before IVF advanced, they used to use that in those treatments. And even in the Bible, they use that as well. So what happens is the couple get another woman in the traditional one, and the man impregnates that. But the baby, by agreement, is for this couple.
To the lady? Yeah,
to this couple. Does not belong to the mother of the surrogate mother. Yeah, it's by agreement. It's the tradition, what we call the traditional form of surrogacy.
So you also breastfeed and nurse the child?
Yes, we can.
But after that, it goes back to the mother?
No, at the time of birth, that baby is supposed to go to the mother.
Immediately to the mother?
Yes, in that case.
Okay.
So because of these complications, as you can see, you can see, apart from the surrogate service here, now the egg is coming from somebody else. So over time, this has faded off. But it's not to be forgotten that it's one of the first ones we used to have, but many years ago.
Thank you. Doctor, I want to know the right period for me to get pregnant. I'm off family planning, although still breastfeeding. Can I conceive while still breastfeeding? Because my boy is now 1 year and 8 months. It's the mother.
Oh, yeah. So if she's already getting her periods, there's a possibility she could conceive.
Okay.
But to increase her chance of conceiving, can we have the line off a bit, maybe? I don't know. Because this question, we need to answer it.
Thank you. Kindly, when you're calling, lower down the volume of your TV set so that does not keep on reflecting back. Yes, you are still explaining.
Yes.
Hello, caller. Good evening.
Good evening. Good evening.
How are you? Who is calling?
This is Asha.
Yes, Asha.
Thank you for the program. Thank you, Doctor.
You're welcome.
What I was asking, I always get infection. Even if I treat it, it comes back.
Sorry about that.
And I've failed to conceive. Now my boy is 5 years.
Sorry.
So I want doctor to help me what could be the problem.
Thank you so much for the call. Doctor will get back to you immediately. This is Asha.
Yes. She says she has two problems. One is of infection and she's delaying to conceive. Yeah, so after this, I think we need to clear the other previous issue of the breastfeeding. I think she wants the information.
Maybe, then we go to this second.
Yes, so I was saying that if she's breastfeeding and she's having her periods, chances are she could still conceive.
Okay.
But to increase her chance of conceiving, it's better she stops breastfeeding completely if she really wants to get pregnant. Because breastfeeding is a form of family planning.
Okay.
Yes, so it's better she stops completely and she gives herself time.
Okay, thank you. Yeah. Let's go to Asha. She's failing to conceive.
And she's getting recurrent infections.
Yes, current infections.
Yeah, so infections and the failure to conceive, in many cases they go hand in hand. Yes, sometimes if the infection is repeated, it can actually cause complications which stop you from conceiving. So this is a situation where...
What type of infection can that be, doctor? Can it be urinary tract or
No, usually not urinary tract infections. Those are severe infections like STDs.
Oh,
yeah, we still have gonorrhea in our population.
Really?
Yes, we do. We still have syphilis in our... We have also chlamydia in our population. Because you see, we're getting into problems of wrong use of antibiotics. These are infections that are very sensitive to medication.
Doctor. Good evening, Bethan TV. Hello. Sorry, we've lost him.
Oh, yeah. Yeah, so we have, these are infections which are very sensitive to antibiotics, but we have used our antibiotics badly. So they are beginning to come back.
They're beginning to bounce back on us.
Yes.
Hello, good evening to you, caller. This is Teacher Zita. What's your name? Okay, can you be a little louder?
You're speaking to Bridget?
Yes, Bridget.
Yeah, I was trying that. I have been on family planning. What should I use the
Okay.
there is this pill that I used to take it once in a month.
Okay.
But later on it was out of stock. And I started using this pill, the baby one, once I used it.
Okay.
But now that I look to the family, I'm no longer with family planning, but I have spent a lot without completing.
Okay.
Thank you, Dr.
Thank you so much, Bridget, for your call. Doctor has got you. She has been taking these pills of once a month.
Yes.
Isn't that the Chinese pill that we talked about last time?
Most likely.
And she stopped using it, but still she cannot conceive.
Yes. So, well, the monthly Chinese pill, as we know it now, is not approved for use, at least not in our population, because we do not have enough scientific information to support its effectiveness and its safety. So I've seen a number of people getting into problems after they have used it for some time. Because things we need to understand about family planning is that we need to know when does it start working, when does it stop working.
Does it stop?
Yes, some of these things we do not know that. Yes, so it's safer not to use, but all the same, since he's already in the issues, he has to come and be evaluated. Is he still having issues with the ovulation, or is he having any other issue? That has to be assessed, because her concern now is the delay to conceive,
yes, in conception.
not the family planning. Yeah.
Thank you so much. We have another message. Good evening, doctor. This is Kagwa Moses from Entebbe. Seasonally, I feel severe pain around the left side of the chest during breathing. When I went to the hospital, they did an echo and discovered that some of my blood vessels are squeezed around the heart. How do you advise me?
Oh yeah, so that is
Moses.
Yes, Moses. Moses is that is a coronary artery stenosis or coronary artery disease. It's a very serious condition. She must work very closely with a cardiologist.
Okay.
If
Who are cardiologists?
Cardiologists are doctors. Cardiologists are doctors who are specialized in the heart.
Oh.
Yeah, and here I would advise him to go to be in touch with the doctors of Heart Institute.
Specialist.
Yes.
Than seeing a general doctor.
Yes, this is a very serious condition, and you know those blood vessels are very tiny, and it could mean life and death in case they block up.
True.
So I hope he's being seen by a cardiologist.
Thank you. Thank you so much, Doctor. Many questions are still coming in. Good evening, Doctor. Thanks for the program. I know the range of IVF charges. I think we talked about that.
Yes, please.
But briefly, you have another caller online, Doctor. Hello, Bethan TV. Hello. Okay, can you be a little louder, dear?
I wanted doctor to give me the number because I have the problem.
You wanted doctor's contact?
Yeah.
It's okay, you can come to Bethan Hospital, Women's Hospital in Luzira.
It is in
Yes, there's also another branch on Entebbe Road, shortly after the lake, after Lake Victoria. You will find it around, yes, close to the traffic lights. It's on the left-hand side when you're going to Entebbe, before Mayor's Garden.
Okay.
Thank you so much for the call. Have a good evening. You were still talking about Moses. cardiologist?
Yes, he definitely needs
to see a specialist.
Yes, and as soon as possible.
Okay. And then we talked about the range of IVF. We said it's around
15 to 19.
15 to 19 million.
Yeah.
Thank you so much. Hi, Beth and TV. Can ovarian cyst lead to infertility in ladies? Yes or no, doctor?
Ovarian cyst, the answer is yes and no. One, because if it's a simple ovarian cyst, which usually results from ovulation site, that one doesn't lead to infertility. It might delay somebody from conceiving because of the hormone disorganizations, but doesn't cause infertility.
Thank you so much.
But the others, like endometriosis cysts, those ones can be associated with infertility.
Thank you.
Yep.
My question is, my menstruation cycle is irregular, and yet when it comes in a certain month, the blood is very, very, very little and light. What causes that, and what would be the problem? Thank you so much, doctor. This is another question.
So menstruation, the flow of blood, is an interplay between the womb and the hormones, the estrogen and progesterone levels. Now, if you have a disorganization of it, those two have to be evaluated. The womb has to be assessed, the hormones have to be assessed. So at this moment, you can't know what her problem is until we understand those two.
True.
And so she definitely needs that evaluation, and the competent doctors will be able to come up with a conclusion.
Thank you so much, doctor. I want to know the right period for me to get pregnant. I am off family planning, although still breastfeeding. I think this is the same.
This one we said, yeah.
Yes, yes, this is the same. Can clients choose the sex of the baby if they went through IVF?
Yes, that's a very interesting question. Yes, it's possible for them to choose, but that will mean before the embryos are put in the woman's womb, we have to do genetic testing, because the embryos look the same. They have no breasts. They are not yet, you know, you can only know it by the genes.
Yes, sure.
Yes, so you do genetic testing to know, so they can choose.
Thank you. Thank you so much. Hello, Beth and TV. Thank you for the show. My name is Joel. Please, doctor, talk about the oils and creams of penis enlargement. How effective are they, and do you recommend them? I think this should be a topic of its own.
Yes, you know, one of the things which is coming clear is we do not have effective support for male sexual challenges. It's ignored. We neglect it. And many men are struggling. They are doing so many things, either to increase their power or the size of the penis and all these things. So it's a big challenge. We have to pay attention to it in our population. Yeah.
Thank you so much. Our viewer who sent this message, Joel, I think one day we shall choose a time when we shall talk about that as a topic. We have another call on the line. Bethan TV, good evening.
Yes, good evening, madam.
How are you? Can you please lower down the volume of your TV set?
Oh, okay.
Okay, thank you. Who is calling?
This is Agnes from Nigeria.
Yes, Agnes. What's your question about?
Yeah, I would like to ask the doctor that I've been trying to conceive for like now 10 years.
Okay.
Not 10 years, 1 year. But I have always very painful cramps.
Sorry.
And I've not conceived.
Okay. Thank you so much, Agnes. Thank you. That is Agnes from Nigeria.
So
she has failed to conceive for, she said 10 years?
Oh, no, 1 year. She
1 year?
changed. Yeah.
Okay.
And she has painful periods.
Yes, painful periods.
Yeah, so failure to conceive for 1 complete year is a concern, and it's one of those definitions we use for infertility. So once that happens, we need to find out the cause in her. She has painful periods. Maybe possible that she could have issues with the tubes, because some of the conditions which give painful periods also have effects on the tubes.
Okay.
But she needs an evaluation for sure to check her tubes, her womb, and her hormones.
Okay.
Yes.
Thank
and
you.
it could also be a problem in a man. We should not forget.
Yes. Sometimes we need to work as a couple.
Exactly. All the time we encourage people to do full evaluation. Yeah.
Good evening, doctor. I'm Joanne from Entebbe. I kindly want to have your number so that I can reach on you because I failed to conceive. Joanne, don't worry. You can get doctor from Bethany Hospital. We have another call online. Good evening, caller. Hello. How are you? Can you lower down the volume of your TV?
All right. Yes, I'm all right. How are you?
I'm fine, thank you. Who is calling?
Yes, I'm calling.
Can you be a little louder? Yes, we are hearing you now.
Are you getting me?
Yes, we are getting you.
Yes, I'm getting you. I've been in sex with my madam here, so the madam cannot get the treatment. I don't know how it comes.
For how long have you been with her?
Yeah, it's like now 1 year.
1 year. Thank you so much for calling. Doctor is here to respond. He has been with the wife for 1 year and she has failed to conceive. What could it be?
Yeah, so again, we thank him for that concern. It's good he's getting concerned before it's long.
Yes.
Yeah, so definitely they need to be evaluated. Now, the problem could be in him as well. The problem could be in the woman. But they need to be, yes, or both. So they need an evaluation. Yes, they need to check the woman's tubes. They need to check her womb. They need to check her hormone profile, and also they need to check his sperms.
Thank you so much.
So those must be checked.
So you need to go to the hospital at least and seek proper medical guide. We have another caller. Questions are still here. Bethany TV, good evening. Hello, caller.
Good evening.
Good evening to you. How are you? Welcome to our class.
How are you doing?
I'm okay. Are you learning something?
Thanks for the show.
Thank you. You're welcome.
Yeah.
What's your name?
I am Miss.
Pardon?
I'm Ismail.
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 Yeah.
Yes, Ismail. Where are you calling from?
I'm called Como.
Yes, please.
I'm the price of IV.
IVF.
Yeah.
Thank you. Doctor talked about it.
The rate is too hard. Hello?
Hello, we are getting you, Ismail.
Yes, I'm saying. The range of 16, 18.
15 to 19.
15 to 19.
Sounds so I don't want to really take this. They are not that many and disadvantages, though that is the format that one has to look for to acquire such a subject.
Okay, thank you so much, Ismail. He's talking about the cost.
It's costly.
Yes, and he wants to hear from you whether there are other arrangements that can enable someone to acquire the process. Yes. I think when you look at 19, it can look really huge.
Yeah, so of course, the truth is it's a costly thing at the moment. It's unfortunate he didn't pick up our promotional season. Yeah, for about 3 months up to the end of December, we had a promotion. We reduced the cost of IVF. I think people were getting IVF done at cost of like 12 million as well. Yeah, so the thing is IVF, the ingredients are expensive. So we had to talk with some of our suppliers because we've been working with them for some time, and we share the pain of our patients. It's painful to have people miss this treatment because they cannot afford. But just let him get encouraged. We are working around the clock. We are humans and we feel for our people. So we all the time we try to find ways. If we get some people to sponsor, that's well and good. And also in the near future, we think it will be very important for us to increase our innovation so that some of these things which are bought can be formulated from here like the media and so on. We are working on that.
Thank you.
It's still at early stages, but we will soon probably start doing some of those things.
Thank you so much, Doctor. We still have a lot of calls coming in and questions, but we are now time bad. Our time is used up.
Yeah.
Well, let's go to our last segment quickly. Myths and facts about this. Number one, sperm donation is only collected through masturbation. True or false?
False.
Very good. Candidates only donate for a paycheck. Truth or false?
False.
Very good. Donated sperms only goes to infertile heterosexual couples. True or false?
In our environment, yes.
Thank you. Blood group difference can affect the recipient's chances with compatibility. True or false?
False.
Very good. The more you donate, the more you grow old. Truth or false?
False.
Thank you so much, Doctor. Please say your last words to the viewer and then we close the show.
Oh, yes. So I want to encourage the viewers that these services are available, but especially people who can be able to donate and they are fit to donate. I want to encourage them. But my special appeal is to the women who haven't yet decided when to start having their children. It's a very good practice to keep your eggs. They have to store the eggs. Yes.
Thank you so much, Doctor. That has brought us to the end of our class discussion between Teacher Zita and Dr. Anna, but we shall bring another interesting stories, another interesting topic next Sunday. Please keep it at Bethan TV because it's here, only here, where you have free consultations and you learn a lot as far as your health is concerned. Please sleep well. We'll see you next week. Thank you.